Visual diagnosis. Let's talk about tongue diagnosis according to 8 principles. Tongue diagnosis according to the 8 principles. The changes in the tongue can give a quick overview of diagnosis according to the 8 principles. These are the tongue and the 8 principles. There's exterior, interior, cold, heat, deficiency, and excess. By observation, the exterior has no changes in the body of the tongue, and the coating can manifest change. With the interior, the structure, form, and color of the tongue can have changed, and the coating will be affected in some way. For cold, pale or bluish tongue body with white coating. When there's heat, there's red tongue body, yellow coating or no coating, and dry tongue. For deficiency, there's Qi deficiency, the tongue will be pale or swollen. And with Yang deficiency, pale or bluish tongue body. For blood deficiency, pale, thin tongue body, and or dry surface of the tongue. With Yin deficiency, red tongue body, cracked, dry, and lax coating. With excess, there will be thick coating. There are various factors to take into consideration when observing the tongue that can influence its appearance. Consumption of various food and beverages can color the coating on the tongue, leading to a false impression of how the coating looks. The following are typical examples of things that will affect the color of the tongue: coffee, cigarettes, wine, licorice, certain sweets, beetroot, and Chinese herbal medicine, as well as spices such as turmeric, paprika, saffron, and so on. It is therefore a good idea to ask a person whether they have ingested anything that could have affected the tongue color, especially if the color of the tongue is different to what you were expecting to see, or when the color is in contrast to the rest of the diagnostic picture. Many kinds of Western pharmaceutical medicine can affect the tongue, whilst changes created by things that dye the tongue have no diagnostic relevance, as they will not have affected the physiological of the body. The changes created by medicines are relevant to the diagnosis. This is because medicine, by its very nature, affects the body's physiology, which creates a change in the tongue's appearance. Therefore, these changes in the tongue's appearance are diagnostically relevant. Antibiotics, for example, have a very cold energy and create dampness in the body. When a person has been treated with antibiotics, they will often have a thick, white, or geographically peeled tongue coating. This is not a false sign and something that should be ignored when diagnosing the tongue. On the contrary, it tells us about the current situation, which will have relevance in the treatment of the patient. Likewise, some asthma sprays are hot and spreading and are dynamic. The long-term use of these sprays can result in a tongue whose front third is reddish and slightly peeled. Even though it is the medicine that is the cause of this change in the tongue's appearance, it is an indication that the medicine has injured the patient's lung yin. It is increasingly common for people to brush their tongues. Removing the coating on the tongue makes the diagnosis more difficult and the conclusions more fraught with uncertainty. You should request that the patient does not brush their tongue in the days prior to consultation so that you can get a truer picture of their condition. It can sometimes be a diagnostic sign in itself that the person brushes their tongue. Dampness and phlegm will often manifest with a thick, sticky tongue coating. This can result in an unpleasant, sticky sensation in the mouth, and the person may well brush their tongue to rid themselves of this unpleasant sensation. Lighting is important. The tongue should be well illuminated during inspection, preferably being viewed in natural light. Direct sunlight is optimal, but unfortunately, most of us do not have clinics with panorama windows, and we do not live in the south of France, but in countries with limited sunshine. Furthermore, many patients book appointments after work when it is dark. We must therefore view the tongue using sources of light other than sunlight. Halogen lighting is one of the best alternatives, but it is far from perfect. So energy-saving light bulbs and fluorescent lighting are, on the other hand, some of the worst alternatives, as they seriously affect the appearance of the colors. It's normally observed that the tongue in either the daylight that is available or illuminated by an ordinary light bulb, and then inspect the tongue using a torch with a halogen bulb. The advantage of using the torch is that one can focus the beam of light on specific areas of the tongue and on the root of the tongue, which is otherwise difficult to illuminate. It is a good idea to train yourself to look at various tongues, first in ordinary daylight and then with the light source that you will be using in your consulting room. This will give you an idea of how the tongue's coloration is affected by this particular light source. The tongue should be relaxed during inspection. It is better to get the patient to show their tongue several times for a short duration, about 15 seconds each time, than to make them visit with their tongue hanging out for 5 minutes whilst you analyze everything you can see and consider the implications of any changes. It is both unpleasant and strenuous for the patient. It will also affect the color and moistness of the tongue, thereby giving a false impression. Thank you for listening.